You are going to move into a career where over time, the time you get with your patients is probably going to be less than doctors are giving now. So I'm not going to be able to tell you in the time I have with you how to have more time with your patients. I can't do it. But I can tell you about how to make the time you have with them quality time. By being in the moment and hearing what they have to say. Going back to the concept of people are dying to be heard. Many of you are going to deal with guys my age as kids. The population you are about to be tending to, unless you're going to pediatrics, we're getting older and older. We're going to tell you our stories. And we're going to tell them slower than you probably want us to. But what the Medical Society of Wisconsin asked me to do, Dr. Simon says is important now to add to your education. Something that in the past for many doctoral students was missing, was a discussion about the human factor. I want to tell you about two doctors, and then I think we'll take some questions if you have them. I see two doctors. One makes me feel like I'm the only person in his life when I'm in the room with him. He's got kids. He's married. He runs a big practice. And yet, for the 15 minutes I get with this guy, I am all he knows as far as I feel. That's what he offers me. Because he's practicing in the moment care. I have another doctor, and his nurse doesn't even look me in the eye. It's just the culture of the office. It's get him in, get him out. They have a lot more patients come through that office than the first doctor. And I know why. Something as basic when I was a kid, you waited till the doctor got you in, or maybe the nurse, into the exam room, and they had you strip down to your underwear to take your weight. They want you to be accurate. Now they say, step on the scale. I said, should I take my coat off? Oh, yeah, I probably want to do that. It's like, but I'm wearing waffle stuff. Don't worry about that. I'm like, well, wait a minute. That's the first thing they always ask. And my thought is, don't you want to be accurate? And if you're not going to be accurate about my weight, I don't really care if it's 5 pounds higher or lower. I'm not all that vain about it. But I'm just concerned that the signal they're sending is, well, I don't care if your weight's not quite accurate. What else are they sliding on? Well, this doctor comes into the office and we speak. Again, sometimes he looks at me and sometimes he seems preoccupied. He never seems like he's in the room. I spoke to students at Aurora Sinai recently. And I had a question, well, why do you keep seeing that doctor if that's how you feel? And I said, actually, I haven't. I've been trying to figure out, what do I do? It's time for a checkup, and I just don't want to go back there. So now I have to go through the effort of making the change to a new doctor, new office, new system. It's not easy to do. I have since called a new doctor's office. They can get me in April. If I have an emergent situation, they'll bring me in, but for the checkup I have to wait till April. I'm willing to wait, hoping that this doctor seems to be in the moment with me. Especially as I get older, I want that care to come from people who seem to really care. And the only way I know that is if they live in the moment with me. People are dying to be heard. And I talk about, how do you listen to that? How do you deal with that? Well, I first started out by writing a book called Unitasking, 25 Tips for Better Listening. That's a nuts and bolts book. It's a CD. You can buy it online, or you can read some excerpts. And it basically says things that are fairly simple. I don't know how many of you did it. I walked in here, and I made sure that this was not muted, not on vibrate, meeting, or silenced. I turned it off. I didn't just do it for you. I did it for me. Because if you're going to listen, you're going to learn to be in the moment as often as possible. The moment is all we have. We have plans. Oh, do we have plans? I've got plans to be at a studio 4 o'clock to give 2 more hours of in-the-moment talk show hosting. And I've got plans to chair a committee meeting tonight. And I've got plans this weekend, watch my daughter play soccer. And I'm sure each one of you could tell me what your schedule looks like for the next couple of days. And I would guess 99.9% of you will hit just about everything in your schedule. But the guarantee you've got is that you have only this moment. I have no guarantee I'm going to make it up the stairs and out the door at 1 o'clock. Anything close to fatal hits me, though, I'm in pretty good company. We'll see who's in the best in the class. But assuming my health stays okay, I assume at 49 years old, I've got 30 years, 40 years, I don't know. I assume I've got more time. Here's a secret. None of us should assume that. When you get in a room with a patient, they're coming to you, and you are not Cheryl or Corey. You're doctor. You are a little bit more elevated in their minds than maybe in your minds. Not so bad. But the way you earn their respect and maintain their looking up to you, even if they're sitting level to you, is by being in the moment. I spoke to a group of students at Marquette University about a year ago. I talked about being in the moment, and a young lady raised her hand and said, you know, I have such problems being in the moment. When I'm talking to my friends or my mom, I'm constantly worrying about the internship I hope I get, and what's going to happen with my student loans, and what about the career? I'm not sure what my career is going to be, and laundry, and homework. And I said, wait a minute. Take a deep breath, will you? She looked at me and said, no, don't just look at me. Take a deep breath and be in the moment with me now. Push everything else out of your head. She goes, okay, I can do that. I said, good. I told this woman from Marquette, guess what? It's 7:30 on a Tuesday night. It's cold and snowing outside. You're not going to pay off your student loans between now and when the class is over. You're not going to get your internship between now and when the class is over. And your career that will happen is not going to start between now and when the class is over. I guarantee you, the things you are concerned about, you will tackle. You'll pay off those loans, and you will get that internship, and you will have the career. All things being equal, with the idea that all you have is the moment we're in. But you're not going to do it unless you live a moment at a time.